would like to start with 4 theses about healthcare reform, but as it affects e-health issues. 4 theses that I don't think are really that controversial, and yet if you actually agreed with all 4 of them, we would have a completely different healthcare debate going on in Washington. And as a preemptive comment, I'd like to say I am a former Republican official who left office January 20th of last year because I'm smart enough not to wait around to get fired. So I recognize that you should discount people of different political parties when they're talking about legislative initiatives of the other party. So let me preemptively volunteer that my skepticism about Washington is not Republican skepticism of Democrats. It is an average citizen's skepticism of incumbents, and it strikes both Republicans and Democrats. So to the degree that that inoculates me a little bit, know that through this talk you're going to hear a lot of skepticism about the ability of Washington to solve complicated problems like delivering an interconnected, higher quality, lower cost healthcare sector, but that is not partisan skepticism. It's skepticism about the ability of central planners to plan something as complicated as 17% of GDP. My 4 theses to start us off. 1, we confuse third-party prepayment of medical expenses with insurance. We confuse third-party prepayment of medical expenses with insurance. We do something different in healthcare than in almost any other sector. I'm going to name the 4 and then unpack them more slowly. Number 2, the bias in our tax code toward employer-sponsored insurance is neither partisan nor intentional, but it's increasingly destructive. The bias we have in our tax code toward large group employer-sponsored insurance against other ways of pooling wasn't on purpose. It wasn't a Republican idea against Democrats or a Democrat idea against Republicans. It was an accident, and yet it's becoming increasingly destructive over time because of the migration of our economy from manufacturing-era jobs to knowledge economy jobs. Number 3, e-health success, if all that you've been talking about over the last number of sessions worked, if there were e-health success, it will create winners and losers. But the winners are businesses that don't exist today and diffuse patients and beneficiaries, also known as groups that don't have a lot of political power. The losers are establishment players in today's healthcare sector, known as people who have been around long enough to be organized to lobby, and we shouldn't be surprised that e-health is unlikely to come as fast as we wish when the kinds of people who would lose are those who are the ones who make campaign contributions. And 4th, Washington isn't very serious about reform. And I say this of both Republicans and Democrats, of both the advocates of current healthcare reform bills and their opponents. Washington isn't very serious about health reform. I want to unpack those 4 a lot more carefully, then get to some summative theses which are slightly less depressing than the net of those 4, and then open it up for a pretty substantial amount of time for questions.